now we have Debbie Schultz.
Hi.
And we're very excited to find out about methylene blue. So teach us.
I'm really excited to be here.
I'd never even heard of it. I had to look it up to find out what it even was.
Yeah, so it's really interesting listening to you guys talk. It thrills me to hear you trying to be so self-sufficient in your nanocanase and your MMS and everything. And so I am very passionate about what I call God's original traditional medicine, and I'm also very grateful for some of the things that God has inspired man to make for our benefit. And so Neil is my husband back here. We're both board certified naturopaths. He specializes in homeopathy, and I am walking the path of the red road to becoming a medicine woman. And I'm more into treatments and fun modalities. So we used to have a wellness center. We closed it down about a year ago and moved it into our home. At 69 years old, we kind of decided that was just too much having a wellness center, and we wanted to be more independent and be able to spend more time with the kids and grandkids and whatnot. But we take a holistic approach to healing the body, mind, heart, and spirit. We believe that they're all synergistically connected, and if one's broken, it affects the others. We like to reactivate our body's own healing mechanism with a holistic and functional approach to creating an environment for the cells and the mitochondria to heal. We bring together conventional Western medicine and God's original traditional for prevention and healing. We named our business Integrated Biohealth because it was really important for us to bring the two together. We know that we need some of the things that conventional Western medicine brings us, but it's also really important for us to take charge of our own health and to be in charge and prevent, you know. And so I am going to pass around an oximeter, and I want each of you to take your pulse and look at your oxygen levels, okay? And then I'm going to pass around a thermometer, and I want you to take your temperature, because this is going to be an indication of what your health is really like. And so write down your results. When you use the thermometer, put it on your forehead like this, push the button and press it up. Oh yes, I am at 98.8, that's really good. You want your temperature to be up there, okay? That's a good indication. So, and I have some little water wipes if you want to wipe in between, whatever.
Don't those affect your pineal gland if you do it a lot?
If you do it a lot, yeah, it probably could.
Don't those affect your pineal gland if you do it a lot?
If you do it a lot, yeah, it probably could.
Yeah, I didn't like the imprinting during COVID with little kids.
Oh, I hate that.
You know,
Yeah.
that was...
Okay, so while that's going around, I just have a disclaimer. So the information presented here is intended for entertainment and educational purposes only. It should not be taken as a substitute for properly informed medical advice. Nothing here can be construed as diagnosing or treating any health condition or illness. Please consult your doctor or the appropriate licensed practitioner before undertaking any course of action related to your health. No statements made here are approved by the FDA. So, but 80 to 95% of all diseases are lifestyle related. That's what we believe in our world. 5 to 20% of all diseases are genetic. And genetics can be like carrying around a loaded pistol, but it's lifestyle that pulls the trigger. So it's interesting because we have learned that you may never get rid of a genetic disease that you've been blessed with, but you don't have to manifest the symptoms. So Neil was diagnosed 14 and a half years ago with cancer. And it wasn't treatable with conventional Western medicine. So we took a holistic approach to treating this. And over the last 14 and a half years, we have never gotten rid of the cancer. It is still there. But he's been healthier than he was before he was ever diagnosed. So he has no symptoms whatsoever. But the cancer is still there. So we just have to watch it, making sure that it doesn't grow. So conventional Western medicine treats symptoms of metabolic syndrome. And natural, functional, or integrative medicine goes to the cause and fixes it. Okay, so we can treat symptoms with herbs and other things, but our goal is to go to the cause. And what is the cause? It's usually malfunctioning cells, and the biggest cause is a dysfunction in the mitochondria. So what causes the problem in the mitochondria? Usually it's the environment of the cell. A lack of respiration by the mitochondria, and this is going to be huge today, is respiration of the mitochondria. A lack of nutrition, toxic overload, and living in fight or flight, and then the vagus nerve malfunctions. And so, how many of you have heard of metabolic syndrome? Are you guys familiar with that? Okay.
I don't know what it is.
Okay, so metabolic syndrome is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Metabolic syndrome is increasingly common, and up to 1/3 of U.S. adults have it. If you have metabolic syndrome or any of its components, aggressive lifestyle changes can delay or even prevent the development of serious health problems. So this is why you're taking your temperature and getting your oxygen levels and your heart rate. This is going to give you an indication as to whether you have metabolic syndrome. So what are some indications? The body temp, if it's lower than 98.6. Oxygen levels below 95 when resting. High blood pressure, resting heart rate should be between 45 and 85. Low energy levels, high cholesterol, can't lose weight around the middle, high blood glucose levels, and low CO2 tolerance. How many of you have heard of low CO2 tolerance?
No.
Okay, something new. All right.
I think this is huge. Right?
This is going, well, and low CO2 is huge, okay? We're going to talk a lot about that today.
Don't take it away
Don't change
yet.
it.
No, okay.
Yeah, because that's me, 100%.
The CO2
Okay.
tolerance?
The whole
Oh,
thing.
metabolic.
All of
Yeah.
that. I'm all that.
You said like 1/3, I would guess maybe even higher than 1/3 of
It could be
Americans.
higher. Okay, you ready?
Yeah.
Oh, you want me to go back?
So, yeah, we're confused with your oximeter. Yeah, what's the top number or the bottom number?
Oh, you have, Neil will help you with that. Okay,
She just.
are we good? Can we go?
I know,
forward?
we're sticking on our finger, but now what?
Go for it. So, okay. So how do we fix metabolic syndrome? Well, first you have to eliminate the problems, okay? So, are you exposed to too many EMFs? Are you exposed to mold? Are you exposed to chemicals? Do you have an underlying virus or a bacteria or parasites? So we have to start eliminating. But before we start detoxing those things from our body, we have to open up the drainage pathways. We have to make sure that as we're killing things off or getting them out of the fat cells, because it's your fat cells that grab onto toxins and hold on to it, and they do that to save your organs. So thank those fat cells for saving your life, okay? And so we need to do it slowly and making sure that you're having a bowel movement, at least one, preferably 3 every day. We need to support the kidneys. We need to move the lymphatic system by exercising or dry brushing. The lungs, deep breathing, and the skin, sweating, or dry brushing. So then we detox, then we repair and heal.
Excuse me, Debbie, did you bring the other pulse oximeter?
Nope. Did that one die?
No, but it's erratic. It's not as consistent as it should be.
Shoot.
It's bouncing.
No, I brought mine and I
Yeah.
darn it.
Just take the high numbers.
So 99.
Okay. So today's focus is going to be on methylene blue. How many of you heard of methylene blue?
Hadn't heard of it till you.
Okay, you're gonna learn today what to do with it, okay. So red light therapy, you're familiar with red light therapy? Okay. I love red light therapy. So I was an esthetician for a lot of years. I guess I still am. I still have my license and still have clients that have been with me for like 35 years. So we started using red light therapy for anti-aging clear back probably 25 years ago. And it's just been in the last 10 years or so that they have discovered so many other health benefits with it. And then photodynamic therapy and balaenotherapy. Anybody heard of balaenotherapy? No. Okay, all right, you're gonna learn some new things. All right, so what is methylene blue? Well, methylene blue was developed by a German scientist who dyed blue genes back in 1876. In the early 1890s, scientists used it to stain bacteria, viruses, and parasites so that they could look at them underneath the microscope. And they discovered that methylene blue killed bacteria, viruses, and parasites. So in 1891, the FDA approved it as the first synthetic drug, and it was approved for malaria. This was before Big Pharma. And it was also it was also one of the first drugs used for psychosis, pain, and UTIs.
And it's the prank thing that boys do to make, or that kids give each other to make you
Pea
be
blue.
green and blue.
Yes.
Does it turn your urine blue?
That's how I
First, depending on the strength. So your urine might be green and it might be beautiful aqua. It just depends on how much you're taking. Okay, so in the 1980s, it was actually used for bipolar. I don't know why I put bipolar. And schizophrenia. But because it wasn't patentable and it was cheap, of course, it was
Blackballed.
pushed. Yes. So for years, it has been used in virtually every emergency room around the world as an antidote to carbon monoxide poisoning, cyanide poisoning, and all other poisoning and anaphylactic shock.
They use it still?
It is on the World Health Organization's top 100 medications that you should have on hand. And it's over the counter, and it's not that expensive. Because what it does, when you get poisoning, it shuts the mitochondria down and it can't respirate. This helps the mitochondria respirate. So it keeps you from, what's it called? I can't remember the word I'm looking for. Keeps you from suffocating.
Anaphylactic shock? No?
There you go. It stops that. But it stops you suffocating.
Anaphylactic shock? No?
There you go. It stops that. But it stops you from not being able to breathe. It helps you breathe. It helps your cells to breathe, respirate, okay? All right, so, and the cool thing is methylene blue is an antidote to snake venom and poisonous mushrooms. So what's the deal with
That's
snake
cool.
venom right now? Yeah, okay. Dr.
Isn't
Artis.
that, part of the vaccines?
Yes?
Yeah.
Yes. Okay. All right. So what happened to methylene blue? Well, so here's the bad thing. Straws weren't available back in the late 1800s, and so people were having to drink it. And it would turn their mouths and their teeth blue, and their urine blue. And so when Big Pharma came along, and they couldn't patent it, they created hydroxychloroquine. And so that was patentable, and it didn't cause your mouth to be blue. And so they went to using hydroxychloroquine for malaria instead of methylene blue. But all these years, methylene blue has been on the side being used by a few people. Then COVID comes along, and hydroxychloroquine is becoming political, and it's
Being banned.
it's resistant to the virus is becoming resistant to the hydroxychloroquine. So some of these functional medicine, integrative, naturopaths start using methylene blue, and it works. And so you guys, I have listened to so many podcasts on this and YouTube videos, and I've read 8 books on it. And I can't tell you where this came from, but here's a story that I think I got it from a podcast. There was a doctor from India here in the United States who was treating his patients with hydroxychloroquine and didn't have wonderful success with a couple. 2 of them were in the hospital on ventilators going down. And he gave them both methylene blue IV high doses, and they both came out of it.
Wow. Wish I would have that stuff.
Yeah, the one, once they came out of it, he took them off and he went back down again. Gave it to him again and came out of it. So, and there was another doctor that used it on 20 patients and had really good success with COVID. So over the last few years, there's been a lot of studies. And if you look at the top here, so
Quick question. So, did you say they went under a coma and it brought them out of it?
they started to code. That code.
Code blue.
Code blue. Code
Okay.
blue, is that what they call it when
Yes.
you're dying?
Yes,
And all the team comes in rushing in and,
right.
yeah,
So if they started to go code blue, how do they give it to them? They put it
IV.
intravenously?
intravenously, yeah. Okay, so it's used commercially, you guys, in fish tanks, and, because it kills the parasites and the fungus in the fish tanks, and, as dyes. And so there's 4 grades of methylene blue. There's the commercial for dyes and fish tanks and laboratory uses. They use it a lot in medical procedures. Like if they're doing thyroid, they can dye where they're going to take out like part of the thyroid. Or they've used it in breast cancer, in removing tissue. They dye the tissue. And so it's been used a lot in the medical field. This methanobulamine, yeah, that's basically lack of oxygen in the cells, okay? And now, over on this other side, they're doing a lot of studies on Alzheimer's, Huntington's disease, and Parkinson's disease, and a bunch of other things such as depression, anxiety, COVID, AIDS, and other viruses, bacteria, parasites. It helps with detoxing. It can help with Alzheimer's, autism, cancer, heart disease, cognitive enhancement, pain, and it supports the mitochondria. It helps repair metabolic syndrome and is the great transition to metabolic medicine. Now, as a naturopath,
Push the button.
my first choice is always going to be food or herbs or homeopathy as my go-to. But I also
You don't
believe
hold
in
it.
integrating some of man's made things, such as methylene blue, and I love low-dose naltrexone for autoimmune issues and cancer. So
Can you say that one again?
low-dose
get past-
naltrexone, it's LDN.
My doctor put me on that. I couldn't get past the dreams.
Is
What dose did he put you on?
I take, it's like made in a wax.
A wax?
She has it
Oh, okay.
made to a certain, and it was a really low dose.
Uh-huh.
And it just messed with my sleep and I had weird dreams.
Yeah, that's about the only side effect to low-dose naltrexone is vivid dreams. Now,
Is that a prescription?
it is a prescription.
Because naltrexone is for
And-
like drug overdose, right?
Well, it started out in the 1980s. They put people on it to help get them off of alcohol and drugs. And they used high doses, like 50 milligrams. And they noticed that these people's autoimmune issues were getting better. So there was a doctor who specialized in HIV, and he put his patients on it and found that a low dose of 4.5 milligrams would take care of their HIV issues. So, yeah, it's a wonderful drug with very few side effects. But it does, I know several people that have used it that enjoy the dreams. I guess if you have good dreams, that's a good thing. And some that haven't had that side effect. Okay? All right, so methylene blue is a synthesized commercially by oxidation of a bunch of different sodium things that I'm not even going to try and pronounce, okay? But it is a synthetic drug used for up to 140 years with very few side effects.
Did you say what the side effects were?
Oh, we'll get to that.
Okay, all right.
Yeah. So how is methylene blue administered? So in a hospital setting, they use high dose in IVs. And there are IV places using it in lower doses through an IV. You can get it in capsule form through a compounding pharmacy, and because it comes in through a compounding pharmacy, you have to have a prescription for it. So, and then the liquid that you drink and take orally. So I thought, oh, the capsule would be the way to go. So much easier. I even looked into buying machines to make capsules because I couldn't find it anywhere I could not get capsules anywhere other than a compounding pharmacy. And
Empty
there-
capsules or
Pardon me?
empty capsules?
No.
Make 'em.
Capsules of
Of the methylene
yeah.
blue, okay.
And so I thought, well, I'll just make my own capsules. Because through a compounding pharmacy, you've got to pay the doctor for the doctor visit to get the prescription, and then they're about $2 a pill. And I looked into doing it, and I figured out why I couldn't buy it on the internet from anywhere but a compounding pharmacy, because methylene blue, it makes one hell of a mess. It is so messy. And the powder is so fine, and it goes into the air, and when I'm making my liquid, I'm wearing gloves and apron, and I'm still getting it on me and getting it everywhere. It's messy. And so, anyways, so I have a story to tell you about how I even discovered methylene blue. So I had a client who had long haulers COVID. She did not have the vaccines, but she got COVID twice. And the second time was really rough. She could not get well, couldn't think straight. She just felt like crap. And so we did some things for her, and she was getting a little bit better, but it was just so slow. And her best friend's son is a functional medicine doctor in Salt Lake. And her friend said, go see my son. He's doing some things that he says are really cool. So she went to him, and he gave her the methylene blue capsules to take at home, but also gave her the methylene blue IV. And so she got 2 IVs a week for 2 weeks, and then did the capsules at home. And he says, you need to go find red light therapy. Well, I had a red light panel, and so she said, so she was coming and using my red light panel. And it was amazing how quickly she got better. But it was like the minute she told me what he was doing, I had heard the word methylene blue before, but I had no idea what it was. But I knew I had to know everything I could about that. And that day after she left, I got on Amazon and started ordering books and researching this out, finding a lab, and so anyways.
Can I say,
Uh-huh.
I have a friend who has found a doctor online who has it, sells it in suppository form.
Okay, I've tried that.
Interesting.
But she doesn't use it as a suppository, she just cuts them in quarters and swallows it like that.
Okay, she's using Troscopics, and it's very expensive, and they're low doses, and they turn your mouth. You saw the picture? If you put it in your mouth, it turns it blue. So, and I bought this, and so I decided I was gonna try it rectally. You know, because the best way to get something into the bloodstream, if you can't do IV, is rectally, okay? So I did it rectally. Well, you know what? It leaks out. And it turned my underwear, my white garments blue. So, you know, you decide. But there is that option. And there is that company. And it's a really good company, but it is expensive. Yeah. Okay,
Who
so.
wants to leak a blue butt?
Exactly.
She doesn't get her mouth blue, I don't know if she takes.
I
it
would
like
love
just
to know what
swallows it
she's
really
doing.
fast.
Maybe she wraps it in bread or something.
Yes, you could do it, Rob.
For a syringe.
Yeah. Well, I have found that using the straw to the back of my throat, I'm just fine. It doesn't taste the best, but it works.
And your skin absorbs it, your mouth absorbs it, your teeth
Oh, yeah.
absorb it, and the blue goes away.
Yeah.
But it doesn't when you spill it and it splashes on the wall. or the
Exactly.
countertop.
Exactly. I want to go back. Let's see. So I want to tell you what I do. I have gotten a prescription. I do have the capsules. They come in a 25 milligram or a 50 milligram, which is a fairly high dose. And so I never put my clients on a capsule to begin with, because you have to do this slowly. You have to get up to it slowly. But what I do is I take the methylene blue in the liquid in the morning, first thing in the morning, and then I put a capsule in my bra, and in the afternoon I take it. Because I'm usually gone during the day. It's just pain in the butt to have to worry about a liquid, you know, in the day.
So do you only take it twice a day?
So,
Does it matter with
2
or
to 3
without?
times a day.
Maybe
We'll
your
get-
body's taking it in energetically too, right through the breast.
It
There
might
we
be.
go,
never know.
homeopathically. I didn't think about that, but that was a good point. Okay, so, also, you guys, this is making a huge thing in the anti-aging industry. And you're finding skincare products with it and healing gels with it. So there is a female doctor who specializes in progeria. Do you know what that is?
Where it
That's
ages really
that
fast.
disease where you're born with it and within 2 years of age, children start to age really, really quickly. So it's a very rare thing, but she had 200 patients. She took skin samples of each patient and put it in a petri dish, put methylene blue on it, and it actually reversed the aging of the skin cells.
Wow.
So I've been messing
Wait, say
around.
that again? They did what?
It
Reverse
reversed
the aging.
aging
By putting
of the
methylene blue on their face or their?
No, in a
on-
petri
in
dish,
petri
on the
dish,
skin
their
samples.
Oh, skin cells.
Uh-huh,
We
yes.
all come
I'm
blue
just
next
wondering,
week.
anybody that's like knows more than me in doTERRA, have you used the yarrow oil? It's blue.
I've used Jarrow.
Does that have methylene blue in it?
No, methylene blue is synthetic, and yarrow is, it's
There's
blue
blue
yarrow.
on its own.
And
Okay.
it's all natural,
Okay.
that's all natural.
Thank you.
Yeah, no, they're completely
Can
different.
I
Okay.
just say, I haven't talked about methylene blue heard about it for a long time, since Frank days, you know? But I had someone who had a really bad toothache, and so I was asking around in some of our groups about a natural dentist, or, did I say clove oil for immediate relief and things like that. But somebody gave him methylene blue, and it just took it right away, the pain of his toothache.
Yeah, it's really good for pain. Yeah, no, they're completely different.
Can I just say, I haven't talked about methylene blue heard about it for a long time, since Frank days, you know? But I had someone who had a really bad toothache, and so I was asking around in some of our groups about a natural dentist, or, did I say clove oil for immediate relief and things like that. But somebody gave him methylene blue, and it just took it right away, the pain of his toothache.
Yeah, it's really good for pain. As you can see, these, and it heals things really quick, because it kills bacteria, viruses. But here's the main thing it does, you guys remember this. It helps the cells to respirate. And oxygen is so important, and so is CO2, and we'll get to that later down the road.
So Debbie, as you guys know, you and Neil, I've been a patient up at Huntsman, and treatment was so hard on my skin. And I look in the mirror and I think, oh, I look like 30 years older than what I am, maybe 40. And it's like, sick. Will this help?
Yes, we're gonna get into that, okay? We're gonna get into that. So, here we go. Who should not use methylene blue? So those that have a G6PD gene, there is a cheap blood test that you can do to see if you have this gene, but also if you're our age, you would know if you had this gene by this age, okay?
What would it show you?
It has to do with oxygen in the blood. I can't remember exactly what it is. Pregnant mothers, and this is mostly because liability reasons. Everything says not for pregnant mothers, you know, not, so
Just to be safe.
just, I don't know, but just to be safe. Nursing mothers, because everything goes through breast milk, and children under the age of 2. You should use caution if you are taking psychiatric medications. So this caution comes from a statement made by the Mayo Clinic where they had about 4 people who came into the emergency room with some kind of a poisoning, and they put them on high doses of methylene blue as an antidote to the poisoning, and they went into a serotonin storm. And But the methylene blue saved their lives, and then they dealt with the serotonin storm afterwards. So let's talk about
A serotonin storm?
what a serotonin storm looks like. So, when doses of 4 milligrams per kilogram or more are taken, methylene blue begins to function as an MAOI inhibitor, thank you, which increases the action of serotonin, and that's what your SSRIs do. They increase the action of serotonin. And that can lead to too much serotonin, which creates a serotonin storm or syndrome. And the side effects are all here, okay? So we're not gonna take time to go over that. If you want a picture of it, take a quick picture. But I do have clients who are on SSRIs that are using methylene blue, but I never take anybody over 2 milligram per kilogram. Okay? So dosing, how do you take this? So, there's a lot of differing opinions out here, but this is what I found works best in my practice. For the average person, I start with 5 drops in about 1/3 of a cup of water or orange juice and take that 2 to 3 times a day.
What about apple juice?
The reason why you do orange juice is because of the vitamin C. Methylene blue works best with vitamin C. I take it with water and then I take a vitamin C capsule after. Because I don't
Take methylene blue and MMS at the same time.
No. Okay. So for a sensitive person, start with 1 drop instead of 5. And I have had 2 clients. I've probably got just over 50 people on this. And I've got 2 people who couldn't even do the 1 drop because they are so sensitive in everything they take.
Sensitive in the way of
They have
nausea?
Herxheimer reactions.
Have what?
Herxheimer reactions.
Like nausea?
A detox symptom, so it might be nausea, headaches, aches and pains, fatigue,
Diarrhea.
can't think straight, anything, detox symptoms and all of that, and it could just be 1 or it might be a bunch of them. My granddaughter started out with 5 drops and it made her nauseous. But she has candida really bad. And so it was killing off the candida so quickly that, so I just had her back off a little bit. She went to 3 drops and she was quickly able to start moving up. But one of the gals, what we had to do with her was to have her put it in the bath water. Instead of taking it orally, we started with 1 drop in the bath water. And now she's able to take it orally, but we had to work her up to that.
Wow.
So, this is kind of a long slide. Take methylene blue preferably on an empty stomach, 30 minutes away from supplement medications and food. Drink it with a straw. Put a straw to the back of your throat so your entire mouth and teeth do not get glued.
Do you put it in the orange juice? So you
So
still
yes.
need to do that with the straw as well, or?
Yeah, the orange juice it's going to make it so it doesn't turn your mouth as blue, but I would still put it towards the back. I have personally not tried that because I don't drink juices. But
You
I
always do it in water? You just do it in water?
I just do it in water.
So Debbie, any kind of straw, metal straw? 'Cause-
So I do use a plastic straw because I want it to bend, so I can get it back there better.
Okay.
Well, it's up to you. I use a bendable, but you can use whatever straw you want.
How long does your mouth stay blue?
I'm gonna say that, so I take it, and then I brush my teeth, and I'm gonna say within an hour it's gone.
Okay.
I've never had anybody say, Ooh, your tongue's blue.
Okay.
Okay. All right, so now the second dose should be taken about 5 to 6 hours after the first dose because it has a half-life of 5 to 6 hours. It stays in the system. It doesn't completely go out of the system for 12 to 24 hours. It depends on each person. But here's the cool thing, is methylene blue knows exactly where it needs to go for your best benefit. It knows which mitochondria to target. So it leaves the healthy ones alone and goes directly to the unhealthy ones. So it can give you energy. And so I tell people do at least 2 doses, but preferably 3, because you want it in your, if you're trying to heal from something, you want the mitochondria functioning 24/7, right? And so you especially want it working at night when you're sleeping, because that's when you heal and repair yourself, okay? So I usually have people divide this, if you're gonna do 3 times, divide that second dose and third dose into 2. You know, so if you're taking 5 drops in the morning and then 5 later on, do 3 in the afternoon and 2 at night. Does that make sense? And then you increase by 1 drop each day until you reach the recommended daily dosing or you feel really good. So I have had some people who are very sensitive to things get up to 5 drops and go, I feel amazing. And I've had other people who are at 5 drops that don't feel anything. So it's such an individual thing.
When they feel amazing, what do they feel?
It's like they can think. Their energy levels are better. They're happier, okay? And so 30 to 60 minutes after taking methylene blue, if it's on an empty stomach, it's going to be in the bloodstream. And that's when you want to add red light therapy to it. And that becomes photodynamic.
Does it matter where you use the red lights?
We're going to get into that, okay? So,
What is photodynamic?
we're going to get into that. I'm just giving you a little teaser here, okay? So after working up from the starting dose, okay, so the starting dose is 1 drop or 5 drops, wherever you fit in there. Then, and you work up to what's called the daily dose, okay? And this, you'll want to take a picture of this. This shows the kilograms and how many pounds. And then the first column is the daily dose. The second column is a loading dose. And the third column is a, you are in trouble, you're really sick, you don't want to go to the hospital, but we give you a higher dose, okay? And I have actually never had anybody up to that higher dose.
80 drops a day.
Okay, so let's just say you weighed 143 pounds. So that would be 65 drops a day. You could divide that into 3 doses, okay?
Wow.
That is a daily dose. Now, if you're up to the daily dose and you've been there for, say, a month, and you still feel like you're not healing like you want to, then you can work up to 130 drops a day. Okay?
And this is if you're really sick, or,
No,
well, this is what you want to do?
you want to be at that daily dose. If you need to be. Like I said, some people only take 10 drops a day, total, and they feel great with it. I've had yes.
I was just gonna say, so you said the capsules come in 25 or 50, so 25 is actually 50 drops. The
Right.
25 milligram capsule is 50 drops.
Yes.
Okay, thank you.
Good question. Thank you for bringing that up. I was gonna do that and forgot. So I have a cousin who is in her 50s, who is way into taking care of herself, but when she saw this, she said, I want that. And so she bought the red light and the methylene blue. She got up to 30 drops a day and didn't feel nothing. But she felt really good to begin with. And so what that told me is that her mitochondria is functioning and she does not need this on a regular basis, okay? And so now she keeps it on hand for in case she's around somebody who has a virus or a bacteria, or if she gets a virus or a bacteria. So back to my friend, or my client, who had the COVID long haulers and she got better so quickly with this. I thought, oh my gosh, every household needs methylene blue and red light therapy. And this was back in February. And in November, I had bought a big red light